How to properly perform CPR. CPR, or cardiopulmonary resuscitation, is a life-saving technique that is used to help someone who has stopped breathing or whose heart has stopped beating. Knowing how to properly perform CPR can make a huge difference in saving someone's life, so let's jump right in and learn the steps. Number 9. The basics. Before jumping into the steps of CPR, it's important to remember a few key basics. First, make sure you have a safe environment to perform CPR in. Check for any hazards, such as water or electricity, and make sure the person is lying on a flat, hard surface. Next, remember to always put your own safety first. If the situation is unsafe, call for help instead of putting yourself in danger. Finally, always remember to stay calm and focused. This will help you make clear decisions and perform the steps of CPR effectively. Number 8. Assess the situation. Before beginning CPR, it's important to quickly assess the situation. Check to see if the person is conscious or unconscious, and if they are unresponsive. If they are unresponsive, quickly check for any signs of life, such as breathing or movement. This will help you determine if CPR is necessary. Number 7. Call for help. If the person is unresponsive and not breathing, it's important to call for emergency medical help immediately. If someone else is present, ask them to call 911 while you begin CPR. If you are alone, call 911 first and then begin CPR. Number 6. Check for responsiveness. Gently shake the person's shoulders and call out to them. If they do not respond, they are unresponsive and you can proceed to the next step. Number 5. Open the airway. To open the airway, tilt the person's head back gently by placing one hand on their forehead and the other hand on their chin. This will help keep their airway open and allow for air to flow into their lungs. Number 4. Check for breathing. Place your ear near the person's mouth and listen for any sounds of breathing. Also, look at their chest to see if it is rising and falling. If there is no breathing, it's time to begin compressions. Number 3. Begin compressions. To perform chest compressions, place the heel of one hand on the center of the person's chest, between their nipples. Place your other hand on top of the first hand and interlock your fingers. Keep your arms straight and use your upper body to push down on the person's chest about 2 inches. Repeat this in a smooth, steady rhythm at a rate of 100 to 120 compressions per minute, which matches the beat of the song, Stayin' Alive, by Bee Gees, as a handy internal metronome. Number 2. Administer rescue breaths. After 30 compressions, give the person 2 rescue breaths. Tilt their head back and pinch their nose shut. Place your mouth over their mouth and breathe out for about a second, making sure to watch for their chest to rise. Repeat this process for a total of 2 breaths. Number 1. Continue CPR until help arrives. Continue the cycle of 30 compressions and 2 breaths until help arrives or the person shows signs of life. Congratulations, you now know how to properly perform CPR. Remember, in an emergency situation, every second counts. By performing CPR, you can keep oxygenated blood flowing to the brain and other vital organs until medical professionals arrive. By following these steps, you can make a huge difference in saving someone's life until then. Keep practicing and stay prepared to help those in need.